Welcome to Global Products MURX Ophthalmology EHR and Practice Management Software. This is the main login screen. Login using the doctor login credentials. Once we log in, we are taken to the main dashboard, which has a detailed navigation menu on the left hand side and shortcut panels to the most frequently used modules within the software. We will now go to the main clinical management page of the doctor module where all the patient data is recorded. Click on patient to consult. It will show a list of the patients arrived at the clinic. Click on the name of the patient and the clinical management module or the doctor module opens up. This is divided into general ophthalmology and subspecialty modules. The topmost part displays the patient details. Next up are the submodules. Here in the OPD page of the doctor module. Patient medical and social history can be recorded by clicking on add update and selecting the relevant option. Comments, if any, can be typed into the free text box. On selecting and saving, the options selected will be displayed in the panel. Next are the ophthalmic examinations. So we click on add update, which opens up the examination module, submodule. There are two columns. The left hand side displays all the examinations and the right hand column the findings for each of the examination. Selections can be made by clicking on the box for right eye, left eye, or both. Chief complaints can be recorded by selecting the relevant option. Similarly, family history can be recorded, ophthalmic history, if any. The ophthalmic history is subdivided into cataract surgery history, glaucoma, and lenses being used, or if the patient is using any. So we click on cataract surgery, which will show the relevant options or the findings. Then there's a list of ocular examinations. Which are divided into vision, external examination, slit lamp examination. So if we click on vision, subdivided into distant vision, near vision, color vision. We click on the examination and the findings are displayed in the right hand column. Similarly, there are lids, sclera, the findings in the right hand column, anterior chamber, and select from the option. Comments or details, if any, can be typed into the free text box given for the particular finding. This fundus examination is subdivided into media, optic disc, undilated, orbit, perimetry, intraocular pressure recording, Chiod's digitally applanation Vision X130. So once The options are selected by clicking on the check boxes for the right eye, left eye, or both the eyes. You can save it, and the findings are displayed in the examinations panel. Any new examination of findings other than the one listed can be added by the doctor by clicking on new examination. Can select a parent examination or just type in the new examination and a sequence number can be given. Similarly, for findings, click on the master button and the sequence number and the finding can be entered and saved to the database. Next up are the diagnosis. To select the diagnosis, click on add. Two options have been provided: diagnosis ICD-10 code database, which is there in the software, and diagnosis non-ICD. A listing can be made by adding or modifying the list by the doctor to the database. Diagnosis ICD-10 codes can be recorded by typing in the diagnosis, which will show or display the complete listing of diagnosis for retina. Similarly for cataract. Once the diagnosis is selected, and select the diagnosis type, the onset date, comments of any, if any, can be typed into the free text box and save. Once the diagnosis is selected, it is displayed in the diagnosis panel along with the ICD-10 code. MURX Ophthalmology EHR has a drug database, and medicines or drugs can be selected from the database by clicking on add. We type in drop, which will give a listing of all the ophthalmic drops. You can select the drop, dosage, frequency, number of months if any, or the number of days. Select the eye, comment if any can be typed in and save, and the drug is added to the list and displayed in the prescription panel. These medications can be made as default prescription for the particular diagnosis by clicking on default prescription and finally save. And coming to clinical vision, click on add update, which will display the chart, and selections can be made from the chart and save, which will be displayed in the clinical vision panel. Auto refractometer readings can be recorded by clicking on add update, which opens up the table. Again, selections can be made and save, which will be displayed in the auto refractometer panel. Glass details for spectacles for distant and near can be recorded. We click on distant. Selections can be made and save, which will be displayed. Similarly for near vision, MURX has a chart for selection. Prism values, IPD and NPD values, the glass type listing, finally all the information is saved into the software. Next up is images can be marked up and saved. Select the image, opens the image editor built in within the software. This can be marked up and saved. Select the eye and save. Allergies, if need to be recorded, can be done so in the software. Lens information, the type of the model, the type of lens, and the name of the company. The model type can be added or modified in the master database. Similarly, for type and name of the company, the listing can be added to or modified. Intraocular lens can be recorded in MURX. There's a listing for the design of the lens. Can select from these. This listing can be added to or modified by clicking on the master button. Similarly, a listing of the company names which can be added to or modified. Relevant values can be entered and saved. Next is the surgery module. Here we have a listing of the surgery names. Can select from the name. Pre-surgery instructions can be selected from the listing. And save. Surgery date can be specified and the timing, and the details saved to the diary listing, which will show the name of the surgery which has been scheduled, the date, the timing, and the visit ID. Once the surgery is completed, the details can be typed in along with the doctor's note. In the surgery master, new surgery names can be added or modified. Pre-surgery instructions can be added to the list or modified. Similarly, for post-surgery instructions, surgery steps listing can be done by the doctor. Doctors can add the surgery steps to be selected later on. A discharge summary is also generated in MURX. It will show the diagnosis, medications, the admission date can be selected, operation date, discharge date, name of the surgeon, assistant surgeon, the anesthesia and the anesthetist, and a discharge summary can be printed from within the software. Letters of a referral and investigations can also be recorded in MURX by clicking on letter and investigation. Here a letter master is provided in MURX, wherein letters can be typed in and saved. Such as fitness certificate or a letter of thanks, and the format can be saved for later use. This will show a listing of the letters to be given to the patient. Issued letters, if any, will be displayed in this listing. Investigations and findings to be given to the patient. The investigation list is provided. Again, the list can be added to or modified in the master list. Selected, it will suppose blood investigation, and the required investigation will be added to the list. And can be saved. Coming back to the clinical OPD module, a prescription can be generated from within MURX. For prescription, certain options have been provided for the doctor to print the relevant information in the prescription to be given to the patient. Options are prescription with glasses, prescription only, glasses only, with header, with footer, diagnosis, and with investigations and advice. Choice has been given to print the prescription in PDF format or Word format. After selecting the relevant options, click on Save, click on Print Prescription. Okay. And this is how the prescription, this is a sample prescription which can be printed on the letterhead of the clinic or the doctor. The diagnosis, examinations, investigations, medication list, and the glass findings, the options which were selected, the prescription printout can be taken. This was the general ophthalmology module. There's a subspecialty module, just cornea. Cornea details, specific details can be entered and saved, such as intraocular pressure, differential diagnosis, keratometry readings, topography, pachymetry, corneal scribe. All the details need to be entered in this free text format and saved. Next is the injury subspecialty. Details for any injury can be saved, such as classification, mechanical closed globe injury, ocular trauma score, Roper Hall classification, retina subspecialty, retina exam investigation, injection number, keratoplasty details can be entered and saved under keratoplasty subspecialty, corneal pachymetry, axial length, IOP details, Shorts, eye care applanation digital, operative details, preserved medium. These images can be marked up using the built-in image editor and save. Next up is the glaucoma subspecialty, medication details can be saved, entered and saved. IOP details, central corneal thickness, fundus examination, OCT, perimetry details can be saved. And MURX has a pediatric subspecialty, complaints just DOV, headache duration, birth history can be recorded, vision, IOP, color vision, facial symmetry, squint motor assessment details. So these are the subspecialties covered in MURX. MURX also can generate reports based on, for example, diagnosis list. Select a diagnosis, can select the from date, clicking on search will give a list of all the patients with the senile cataract diagnosis, the patient ID, encounter ID, and the date on which it was recorded or saved in the software. A printout can also be taken. Finally, we have the billing and payments module. Billing head can be added to the database by the clinic or the doctor, the hospital, along with the billing head code, and these can be added to or modified and the amount specified to generate the bill. Select from the billing head and the amount displays, you add to the list. Consultation charges, add, and the payment details can also be recorded. If the payment is collected in cash, the details can be recorded in the billing and payments submodule. If collected by check, check details, by card or other methods such as UPI, any UPI payment or any payment app, and a receipt can be generated in MURX. Drugs, if any, can be added to the drug database from the masters. There's a drug master, the clinic or hospital. The doctors can add drug to the main drug database. Click on add new. The drug code, drug name, brand names are not mandatory, and the drug can be approved by the doctor in the hospital or the clinic. This is the MURX ophthalmology EHR and practice management software.